Hello, and thank you for joining us today. My name is Taylor Kleffel, and I am the Senior Manager of State Policy at AFSP. Today, I will be providing an overview of LGBTQ suicide prevention and our key policy issue areas, as well as related legislation. I will then be joined by Virginia Delegate Danica Rome for her thoughts on what we're seeing on the state level around this issue and why advocacy is so important. And finally, we will provide some related resources and action steps you can take. So to set the stage for the content we'll be covering today, we know that the factors associated with a higher prevalence of suicidal behavior in LGBT individuals are directly related to the harmful and discriminatory bills being introduced. Specifically, those factors include social isolation and low self-esteem, substance abuse, depression, anxiety, and other mental health issues, often resulting from or worsened by stigma and discrimination, experiences of prejudice and discrimination, including family rejection, bullying, cyberbullying, harassment, and mistreatment. And then a major one relevant to this presentation is the laws and public policies that encourage stigma and discrimination, as well as the lack of laws and policies that protect against it. To illustrate this impact, a recent survey found that nearly 1 in 3 LGBTQ young people said their mental health was poor most of the time or always due to anti-LGBTQ policies and legislation. Nearly 2 in 3 said that hearing about potential state or local laws banning people from discussing LGBTQ people at school made their mental health a lot worse. Conversely, 79% of LGBTQ young people said hearing about potential state and local laws trying to ban conversion therapy made them feel a little or a lot better. So while our work has focused on the attacks on LGBTQ youth, many of the states that have already passed those bills are starting to go after adult gender-affirming care, for example, as well. Specifically, Florida recently enacted public policy to restrict transgender care for everyone, which we will go into more detail later, and Missouri banned Medicaid coverage for care. For that reason, I do want to note a few points of data. We will be expanding our work to focus on the entire LGBTQ population as we further develop our policy position in 2024. So among LGBT adults aged 18 to 49 years in the United States, in the past 12 months, 2.58 million reported having serious thoughts of suicide, 1,006,000 reported having made a suicide plan, and 363,000 reported having made a suicide attempt. Now to dive into the youth data, which is where our current policy work has really been focused. Research has shown that LGBT people have much higher rates of having attempted suicide at some point in their lifetimes as compared to their non-LGBT peers. For those who identify as transgender, about 40% of attempted suicide, 9 times higher than the general rate of the US population. Among students in grades 9 through 12, almost 50% of gay, lesbian, and bisexual students have seriously considered attempting suicide, while the percentage among heterosexual students is 14.5%. Trevor Project recently released their 2023 survey results of youth ages 13 to 24 and found 41% of respondents seriously considered attempting suicide, 14% attempted in the past 12 months. The survey also provided critical insight on the detrimental impact of external societal factors and discrimination. 56% of youth who wanted mental health care were unable to receive it, which is incredibly important considering 67% of LGBTQ young people report experiencing symptoms of anxiety, including nearly 3/4 of transgender and non-binary young people. And 54% of LGBT young people reported symptoms of depression, including more than 3 in 5 transgender and non-binary young people. Only 38% of LGBTQ youth, or 1 in 3 transgender and non-binary youth, found their home to be gender-affirming, and just over half said the same for their school. 15% of LGBTQ youth reported being threatened with or subjected to conversion therapy. I also want to note that respondents who reported these experiences also reported higher rates of suicide attempts. So we'll now go into AFSP's policy positions and cover those in more detail, as well as what we've seen around the country as far as legislation. AFSP has officially supported bans on conversion therapy as a key policy priority since 2015, working in collaboration with the Trevor Project and other state-level LGBTQ advocacy groups. After working on this issue for several years, discussions started on possibly expanding our work toward the end of 2020, but especially in 2021, we saw a slew of discriminatory state bills introduced across the country. We heard from many of our chapter staff and volunteers who were interested in doing more to support the community. As a result, our National Public Policy Council and National Board approved 3 additional key policy areas that we will cover today. Getting more involved in broadening our work in this area reflects where AFSP is going as a whole, because we believe it's our individual and collective responsibility to support the mental health and well-being of LGBTQ people. We have a far reach and in that sense an obligation and responsibility to use the goodwill AFSP has built over the years to make sure LGBTQ youth in particular know they have our support. So our first public statement was in March 2022, and it was a joint statement with the Trevor Project, saying we strongly oppose any legislation or policy that threatens the healthcare of the LGBTQ community or bans the discussion of topics regarding sexual orientation or gender identity in classrooms. It noted the work that the Trevor Project has been doing for years through its state and national advocacy work. And it also talked about that because these policies are highlighting several states and affecting mental health, and because research demonstrates the negative impacts of mental health, AFSP was dedicated more than ever to supporting the community. At this point, the work was still new, so we highlighted the states we'd actively opposed bills thus far, which included Florida, Tennessee, Idaho, and South Carolina at the time. The text here is from a follow-up statement released this past April to recognize how many more bills and harmful efforts we'd seen across the country in 2023. Also included here was an emphasis on the fact that it's not an individual's LGBTQ identity that elevates risk for suicide. It's experiences of trauma, violence, discrimination, and marginalization that increase the risk of suicide for LGBTQ people when experienced on the individual level as well as the macro policy and cultural level. So we're going to be focusing on the 3 new policy areas AFSP has been working on. But before that, I just want to note a couple more things about conversion therapy. So we support efforts to hold mental health professionals accountable through legislative action banning the practice of conversion therapy. While we've worked on supporting these bans for a while, I do want to note that a new development in this area that started around the same time as these other harmful bills we're going to discuss is legislation to prohibit or ban conversion therapy bans. So in North Dakota, for example, there was a bill that AFSP opposed this year, which would have explicitly permitted licensed social workers to engage in conversion therapy by stating it's not an ethical violation. In Oklahoma, there was a bill passed in 2022 protecting conversion therapy from being prohibited in the state by explicitly permitting mental health providers to engage in the process. And Indiana enacted a first of its kind law this year banning any local level bans on conversion therapy. And it's also important to note related to this, a recent study found that parent-initiated attempts to change their child's sexual orientation during adolescence was associated with more negative mental health problems for young adults, and that those who experienced conversion therapy were more likely to have suicidal thoughts, report suicide attempts, and higher levels of depression. So it's really important that we continue to work on this issue, but I do want to go more into the 3 new issues we've been working on this past year. And those are listed here. Between these 3, in 2023, we actively supported or opposed bills in 21 states. For each of these, I will provide some background and specifically make the connection between these issue areas and suicide prevention, and then provide some examples from 2023 of bills that we either actively supported or opposed. So the first, access to gender-affirming care. Feelings of gender dysphoria associated with incongruence between one's physical traits and gender identity are associated with mental health challenges for transgender and non-binary youth. They're at increased risk of experiencing depressed mood, seriously considering suicide, and attempting suicide. Transgender youth report a higher prevalence of suicide attempts than their LGBT peers, 3 times the rate of their cisgender peers. Gender-affirming care seeks to minimize the distress transgender people experience by providing a supportive, non-judgmental environment that acknowledges the individual's gender identity or uncertainty about their gender identity. Every major medical, psychological, and psychiatric association agrees that withholding science-based treatments can be psychologically damaging, especially to youth who are struggling with their gender identity. The current standard of care guidelines from the World Professional Association for Transgender Health and the Endocrine Society has been endorsed by the American Academy of Pediatrics, American Medical Association, U.S. Department of Health and Human Services, and others. Research supports a significant relationship between access to gender-affirming hormone therapy and lower rates of depression and suicidal thoughts and behavior among transgender and non-binary youth. One study found that among transgender and non-binary youth ages 13 to 20, receipt of gender-affirming care, including puberty blockers and gender-affirming hormones, was associated with 60% lower odds of moderate or severe depression and 73% lower odds of suicidality. And I do want to note a lot of these bills often claim to only be addressing surgeries, but all but maybe one we've seen, which was an Arizona law, also banned hormone therapy. While we know, as I mentioned, the research supports a significant relationship between access to that therapy and lower rates of depression and suicidality. Additionally, access to pubertal suppression treatment is associated with lower odds of lifetime suicidal ideation among transgender adults. So to emphasize, non-scientific healthcare standards dictated by policymakers have no place in clinical decision-making and can only serve to interfere with the doctor-patient relationship and prevent the provision of appropriate supportive life-affirming care. It's also worth noting the actual definition of gender-affirming care is a supportive model of care consisting of medical, surgical, mental health, and non-medical services for transgender and non-binary people. For children in particular, numerous factors are used to determine the appropriate intervention and the timing of those interventions, which vary from social affirmation and counseling to puberty blockers, hormone therapy, and in some cases, gender-affirming surgeries. All are assessed on an individual basis. And then just wanted to show a list. These are organizations that have put out a public statement opposing any bans on gender-affirming care, as well as opposing conversion therapy practices and supporting bans on conversion therapy. So the gender-affirming care ban's key components. Before I get into that, I want to note among transgender and non-binary young people, in a recent survey, 11% reported being on gender-affirming hormones and 2% reported taking puberty blockers. 65% of those who were on gender-affirming hormones were somewhat or very concerned about losing access to this care. So prior to the 2023 legislative session, only 4 states have restricted access to gender-affirming care: Arkansas in 2021, Alabama, Arizona, and Florida in 2022. This year, there have been more than 130 bills introduced in over 32 states. So I do want to note that while the statistics about the percentage of bills that pass may be low, so while it might be that only 10% of these harmful bills pass, this can be misleading or not provide an accurate picture, because that can mean that bills have passed in most states, and most states introduce multiple bills that are very similar. Prohibitions on surgical procedures as well as hormone therapy and puberty blockers is the first component here. It's important to note that in every bill or law, these treatments are allowed in medical situations outside of gender dysphoria. So one example is Idaho, which HB 675 from 2021-2022 session did die in committee, but it would have made it a felony punishable by life in prison for anyone to provide gender-affirming medical care to minors or transport a minor out of state to obtain gender-affirming medical care. So that one's a little bit more extreme, but potentially where things are going in the next legislative session. I do want to make another note of an exception. West Virginia's law, which was adopted this year, actually contains an exemption and permits doctors to prescribe medical therapy if a teenager is considered at risk for self-harm or suicide. So this is the only law we've seen that. Penalties for healthcare providers, whether they refer or provide the services, can be a misdemeanor or felony. Loss of license often allows for future civil action after the minor turns 18. So, for example, an Oklahoma bill would allow it up to the time the patient turns 45. Also, in terms of language to include restrictions on social transition, making it easier to file malpractice suits. Notably, Montana's SB 99, which just recently passed, will prohibit the use of state properties or resources to knowingly promote or advocate for social transitioning, which can include the adoption of new names, pronouns, or appearances. Montana is the first state to specifically target social transitioning, and this is a major concern because it's only going to make doctors more wary of the services they're providing. We're seeing provisions related to child abuse or welfare laws and issues of custody. So in May, Florida's SB 254 grants state courts temporary emergency jurisdiction over a child if they've been subjected to or threatened with sex reassignment prescriptions or procedures when a Florida parent opposes treatment being pursued under an out-of-state parent. Some states have implemented rules and regulations for state health departments and child welfare agencies that add gender-confirming care practices to definitions of child abuse. Restriction on use of public funds. Missouri law that passed this year bans Medicaid coverage for adult transition and gender-affirming care for individuals that are incarcerated. And then I also would just want to note related legislation that we've seen to permit refusal of healthcare services based on religious, moral, or ethical beliefs or principles. In every state this has been passed, it's referred to as the Medical Ethics and Diversity Act. So Arkansas was the first in 2021. Ohio also passed in 2021, South Carolina in 2022, and Montana in 2023. And we've seen these bills introduced in nearly half of states this year. I also do want to mention before we move on that the new Florida law mentioned earlier regarding custody also now requires transgender adults to sign informed consent forms adopted by the Board of Medicine and Board of Osteopathic Medicine before continuing care. The forms are medically inaccurate with loads of false, non-scientific information, intentionally vague, and full of transphobic language that could scare patients from getting care and doctors for providing it. The forms claim gender-affirming care is speculative and based on limited, poor quality research. The reason to note this is also what we might, a preview of what we might be seeing in 2024, going after not just youth, but also adult care. So other area that has primarily focused on opposition efforts is opposing limits and restrictions on discussion and instruction in schools on LGBTQ issues. So schools have a critical role to play in addressing and supporting student mental health. Children and teens are continuing to experience significant stressors. Rates of psychological distress among youth, including symptoms of anxiety, depression, and other mental health conditions have increased, as have the number of young people visiting the emergency department for mental health emergencies and suspected suicide attempts. Even pre-pandemic, mental health challenges were the leading cause of disability and poor life outcomes in young people. While just over half find school affirming, this is much higher than those who find home affirming at just 38%, which shows how important it is that schools are an affirming environment. Negative school environments and discriminatory experiences further threaten LGBTQ students' safety and well-being. But when they view school personnel as supportive, they feel safer, report less absences, experience less victimization, and feel like they belong in their school community and maintain higher grade point averages. So in terms of the key components of what we've seen legislatively, we've seen more than 60 of these bills introduced. I want to note that for our purposes, this does not include any bills around transgender participation in sports or bathroom bills. So the first component, ban or restrictions on instruction, library books, or textbooks on topics related to gender identity, sexual orientation, or social emotional learning. So Oklahoma's SB 973, which has not passed yet, would ban kindergarten through sixth graders from learning about sexual orientation or gender identity, and in grades after that, require the teacher to spend equal time on two gender perspectives. SB 1017 would ban public schools or public school libraries from including books that make LGBTQ issues their primary subject. From last session, one of the first bills we opposed was in Tennessee, HB 800 SB 1216, would have prohibited schools' use of textbooks or instructional materials that promote, normalize, support, or address lesbian, gay, bisexual, or transgender issues or lifestyles, end quote. The other component prohibits schools from respecting students' gender identity, preferred pronouns, or require school personnel to out students to their parent or guardian without the student's consent. After passing through the legislature, Arizona's SB 1001 was vetoed by the governor, but it would have prohibited school personnel from addressing, identifying, or referring to any student by a pronoun that doesn't align with their biological sex without written permission from the parents, which is typical language we've seen in most of these bills. But in this bill, even then, it would have allowed personnel to refuse to refer to the student by their preferred pronoun if contrary to their religious or moral conviction. And then there was a bill in North Dakota adopted this year prohibiting schools from adopting a policy on respecting and accommodating a student's gender identity, essentially forcing schools to allow personnel to discriminate against transgender and non-binary youth. Parental notification and permission. So first are the types of bills mentioned above to require parental notification about a student's preferred pronoun or how they identify. Another effect, or essentially requiring personnel to out the student without their consent. Another effect of some of these bills that could have severe negative consequences is barriers some students face to help seeking, for example, with a guidance counselor or school-based mental health professional. So in Kentucky, a law was passed that in addition to limiting classroom discussion on human sexuality, requires schools to report to parents anytime a student seeks mental health care or guidance regarding human sexuality. Pennsylvania currently has a bill that would require schools to provide all parents with a form to withhold consent or decline a school-based healthcare service, and to create a process for notifying parents of a change in students' mental, emotional, or physical-related healthcare services or monitoring. And then procedures for parents to review or request removal of curriculum and related materials, and require parental notification in advance of LGBTQ inclusive curricula. So there's opt-out versus opt-in. Opt-in requirements are much more restrictive. So for example, an Oklahoma bill would allow parents to review any learning material and require that they opt students into instruction on subjects including race, gender, gender identity, and sexuality. Parents must also consent to students receiving any kind of mental health therapy. So the last issue area is SOGI, or sexual orientation and gender identity data collection, which includes activities such as public health surveys and population social science research efforts, as well as a specific focus on mortality data collection, all of which play an important role in suicide prevention efforts. While it's clear that LGBT youth struggle with suicidality statistically more than their individuals who identify as heterosexual, researchers do not have reliable data about suicide deaths and must instead rely on attempt data. Because mortality data is not, LGBTQ mortality data information is not routinely collected in the US or anywhere in death reporting systems or anywhere else at time of death. For this reason, AFSP supports efforts to include routine or systematic collection of information about individuals' sexual orientation and gender identity in mortality data. On the other hand, AFSP also opposes any efforts to limit or skew public health data by limiting definitions of sex or gender in state statute and language used by state departments and agencies, or by banning certain surveys and health-related data collection altogether. Behavioral health data informs decision-making on how to address public health concerns like suicide. We need usable SOGI data to inform where and how to allocate resources and to shape policies that can help prevent LGBTQ suicide deaths in the future. Linking this data offers new insights and can be used by state public health officials to better target and evaluate their prevention activities. Collecting data, including at time of death, that is inclusive of all populations at risk of suicide, is crucial for researchers and policymakers in identifying trends and patterns affecting individuals that might otherwise be overlooked. Exclusion of these individuals can hinder the development of effective suicide prevention strategies and lead to incomplete and inaccurate information about suicide risk and deaths. So the main types of legislation, first, things we are supportive of. Coroners and medical examiners trained on SOGI mortality data collection and reporting. Unfortunately, since most are not trained, when asked to provide this information, the answer is usually unknown, which results in the data being functionally unusable. So one example is California bill adopted in 2021, establishing a pilot program to train coroners and medical examiners on the collection of this information in cases of violent deaths such as suicide. Then we also support inclusion in behavioral health surveys. So for example, health databases like CDC or state-maintained databases. A Hawaii bill requests the Department of Human Services, Department of Health, and Department of Education to collect information on the SOGI of respondents and behavior risk factor surveillance system and the youth risk behavior surveillance system. On the other side of this issue, there's laws we oppose, either outright banning participation in surveys, like, for example, Youth Risk Behavior Survey, or requiring parents to opt in because the survey mentions issues of sexuality or gender identity. And this is often part of the same law mentioned above on opt-in requirements for curriculum. By requiring active consent, which means opt-in versus allowing for opt-out, we will lose information regarding the very children who are most at risk. As a result, the data coming from these important public health surveys will be misleading and skewed. This faulty data would then be used to make policy and provide decisions on the ground, harming prevention efforts. It's also worth noting that research shows that most parents who fail to return consent forms for research participation do not actually oppose their child participating, but rather fail to overcome barriers such as the time or focus it takes to return the paperwork. This is going to be a primary issue for AFSP, both because of the relation to broader attacks on LGBTQ individuals, but also its role in our advocacy work and the data on mental health and suicide prevention. We most recently joined other public health organizations in Texas to oppose a bill that would have prohibited classroom discussion on human sexuality and gender identity, but also would have restricted access to youth health data by making the YRBS opt-in. And we also have a new resource on our website right now on the Youth Risk Behavior Survey as we continue to see these bills introduced next year. Research consistently shows that asking about suicide does not increase risk. Instead, it increases transparency and increases an environment where students are more likely to ask for help and able to envision a path toward mental well-being, which is why these surveys and questionnaires about students' mental health and suicidality are so important. And then the last area is prohibit the collection of vital public health data for transgender and non-binary youth and adults through narrow definitions of 2 genders only. So Kansas did this year by adopting a law allowing only for the use of male or female at birth in collection of public health data by school districts, state agencies, and departments. And North Dakota did it this year by narrowly defining male and female in all North Dakota state code related to biological reproductive system or sex. So with that, I will now turn it over to Virginia Delegate Danica Rome. Welcome, Delegate Rome, and thank you so much for joining us.
Thank you so much for having me, Kelly.
Absolutely. To give a introduction here, Delegate Danica Rome is in her 3rd term serving the people of the 13th District of the Virginia House of Delegates in Prince William County and the city of Manassas Park. She's a former newspaper reporter, the child of someone who died by suicide, and the first out and seated transgender state legislator in American history. We are very honored to have you. Just generally what you think about the anti-LGBTQ legislation that we've seen introduced around the country over the past couple of years, even in what are considered more liberal states, and specifically the spike of number we saw in 2023.
Sure. So the first thing to note is that the overwhelming majority of the more than 500 pieces of anti-LGBTQ pieces of legislation filed by state legislators, and that is more than 500 times that those legislators did not prioritize fixing roads and feeding kids, or taking care of making sure people aren't being left uninsured, or any of the day-to-day quality of life issues that people deal with, because they spent their time singling out and stigmatizing the very people they're elected to serve, and at that, their most vulnerable constituents. And so I see things very, very differently, where I work to make Virginia a more inclusive Commonwealth. So no matter what you look like, where you come from, how you worship if you do, or who you love, you are welcome, celebrated, respected, and protected here because of who you are, not despite it, and not for what discriminatory politicians tell you you're supposed to be. And when we are trying to do something to combat, suicidal ideation, when we're trying to tell people that you're safe, that you belong here, I tell them that you belong here because of who you are. And I say this over and over and over again, and I have for the last 6.5 years, because it's so important for people to know that they should be able to live as their authentic sense of self, and that people, especially people in power, will welcome them and say, hey, you belong here too. And we know what the data shows us. Yes, a lot of people are very familiar with the statistics about the number of percentage of trans people who attempt suicide at least once in their life or have suicidal ideation in life. What is less talked about is that trans people who come from affirming backgrounds with supportive families, supportive communities, supportive schools have the same 4.6% suicide attempt rate as the rest of the country. And so we know that making sure that people feel safe to be themselves, to talk with people without having to have fear of repercussion, but just to talk and say, hey, here's what I'm going through. And to have trusted adults in place who will say, hey, I want to make sure that we are looking out for the best interest of you. I want to make sure that we are taking care of you. That doesn't mean we're shutting out parents. It doesn't mean that we're shutting out families. It doesn't mean any of that. It simply means that we are going to do everything in our power to keep kids safe. And we want to keep kids safe so that they grow up to be adults in the first place.
Thank you. And to that point, some of what we see as far as the reporting is that, okay, so there were a lot of bills introduced, but only 10% of them actually passed. However, like you pointed out, when it's 500 bills, that could technically be a bill in every state. So if you could speak to that, and even more specifically, how do these bills impact youth in those states, even if they're not enacted?
Absolutely. So when I talk to psychologists, when I talk to mental health professionals, and they tell me, my patients, my clients absolutely hear this immediately. Like when they know it, trans kids and LGBTQ youth in general are pretty plugged in terms of what's going on in terms of, politics and their civil rights. And it's not that they're going to have the understanding of an adult. It's not that other kids aren't. It's that they are aware that some people are out there to hurt them and that some people are out there to take their rights away. And, the Washington Post did a story about how there was a family with a trans teenager, and his mom had to drive him from Mississippi to Alabama just to be able to get his medicine. And then after, they were worried about what's happening with the courts, what's happening with everything else as Alabama's, attack on trans care was going forward, that the family, where this is a family with 3 siblings and the parents are divorced, the teenager is now having to live here in Virginia with his dad in order to make sure that he can continue accessing his health care that his parents support him being able to have in the first place. And so the very people who are saying, hey, this is a parents' rights issue, how about the rights of these parents to be able to take care of their kid? And they're trying to chase this family and this trans kid out from their state. And where they're coming instead? They came to Virginia, where my bill that we passed in 2020 specifically states that transition-related healthcare is medically necessary and that it's against the law to discriminate against trans people in our healthcare. You need to have not just bad bills be defeated, you need to have good legislation in place that welcomes all families because of who they are, not despite it here in Commonwealth.
Thank you. And to that point, this has been a tough year for some AFSP advocates who have had to have legislative meetings on this issue. What advice do you have about when it is a tough issue to discuss, how you address misinformation or explain what the issue really is in a way that they might be receptive to?
So the first thing here, I was asked recently, what am I supposed to do when my kid has this trans kid in class? What am I supposed to do? I'm like, well, get to know the kid, get to know their family, get to know people. And just like any other time that you're going to have in your life, a conversation where you're going to have to learn a few things in order to be able to speak well on it. This is one of those things where, okay, if you don't have a trans person in your life, at least not a person who you're aware of, get to know someone who is. Just say, hey, I'd love to, take you out for a cup of coffee. Just, let's just talk about things. I'd love to get to know who you are because, I've got questions, kids got questions. I don't want to put you in an uncomfortable position. I don't think that the whole world, you shouldn't be responsible for having to individually educate every single person. But if you're not, being too burdened right now by a lot of other people, I would like to get to know you and your family, just, find out about your story. And just having those conversations person to person to person, that's the best thing that you can possibly do. And the second part on this is look at reliable data from neutral, disinterested third-party observers, right? And also look at people who are using sound methodology in terms of polling, in terms of storytelling, in terms of everything else. The reason for that is you so often see the anti-trans people on the internet in particular who will push misinformation and disinformation out about trans people that can easily be rebutted, rebuked, or takes one thing and exacerbates it. We see this happen all the time. And this is why it's important for, as someone who spent 10.5 years as a newspaper reporter pursuing journalistic mission, to make sure that the sources that you are relying on aren't simply ones who conform to your preconceived worldview, but are actually done with an editorial process that actually has a journalistic mission behind it. That is so important, is making sure that you're consuming information and consuming news that is done with journalistic integrity behind it.
Thank you. And to build off that, when people do go into meetings to talk about these issues and how they relate to mental health and suicide prevention, on one hand, we want to make sure they have the data. So we know that every major medical, psychological, psychiatric association has spoken out against specifically the gender-affirming care bans. But where does the data kind of stop being effective and the personal story come in, and just any other advice you have? What works with you when a constituent comes to meet you and talk?
When I was giving a speech just yesterday, one of the things I mentioned to people right afterward is, hey, I sprinkled in bits of statistics about like, hey, here's an intersection where the addition of modern roundabouts cut car crashes, traffic crashes by 92%. And that the other crashes that happen there are less lethal side swipes, right? As opposed to angle crashes, which are more, just bluntly fatal and more prone to serious injuries as opposed to roundabout crashes. I mentioned a lot of statistics when I was not just talking about that, but other things about transportation and data like that. Not because my goal was for everyone to come out and say, wow, Danica really knows her numbers. And could you believe that percentile figure that she gave us on whatever? That wasn't the point of that. The point of that was to simply demonstrate that, yes, I have looked at this issue. Yes, I know what the data is. And I've got the sources. I'm going to tell you everything where it's coming from. The personal story with it, where you connect human to human, is the sort of thing that I've learned how to do as a newspaper reporter in particular, where one of my former bosses, he'd just say, tell me a story. It's one thing for you to just recite facts with the inverted pyramid, and congratulations, you have a factually accurate news story. That's fine. We want you to write factually accurate stories. As you are writing that factually accurate story, tell me a story as if you're talking to another person. Connect with someone over this. Share anecdotes, share lived experience. Because when you share lived experience, you are inherently sharing something that happens in two ways. Number one, all of us share one thing in common: first person perspective. You are sharing something that has happened to you that is unique to your life. Number two, the thing that happened to you that is unique to you is only unique in that it happened at a particular time, place, and person, that being yourself. However, there's going to be a lot of other people who can relate to what you're talking about. And if you can't relate to it, you can at least learn about it. And that's where hearing that personal story and hearing the humanity behind it, you are then going beyond just here's what cold-hearted, statistics and data show us and tell us. You're getting into the, hey, this is my story. This is my life. This is what I've actually experienced. And I'm being vulnerable enough to share this with you because I think it's important that you hear this as well, and that other people who really, really need to know that they're not alone in the world can also say, hey, that sounds like me. Something like that happened to me too.
Thank you. In addition to that, as far as what's effective, there's also kind of toeing the line with self-care when going into these meetings. And this is something we work with our advocates on because most often they're lost survivors who have lost someone to suicide. So they're already tackling a difficult issue and sharing their personal story. At what point is it worth trying to go to meetings where you're having difficult conversations with people who might not agree with you, versus kind of taking care of yourself and stepping back and focusing on conversations that might be more productive?
Well, number one, let's always prioritize productive conversations, right? Because even if someone isn't going to agree with you, that doesn't mean that the conversation's not productive. That, reasonable people can disagree, but that doesn't mean that they have to bully you about it. That doesn't mean that they have to backstab you about it, quite frankly. It doesn't mean that they have to lie to you. And look, I mean, when I was an advocate in 2016, when I drove to Richmond, 4 times to fight 9 anti-LGBTQ bills. And I was spending the entirety of my time talking to Republican legislators and their staffs. The whole reason I did that was because it's like, hey, look, they're the majority. This is who I need to talk to. And I had one of them tell me, okay, well, I still plan to support this one bill, but I can vote with you on this one. And that person then voted the wrong way on both bills. And I was just like, how could you possibly have just taken an hour out to talk to me in your office, and then this is how you acted afterward? You just lied directly to my face, and that was one. And that person, by the way, lost their next election the following year. And so that's just one of those things where I knew how frustrating that was as an advocate. I was so angry that that happened, that someone just lied directly to my face over it. At the same time, I also recognized that having those conversations very often meant I was the first out trans person someone knew they were talking to. It's not that, they've never met a trans person before. We walk among you, it's like, it's very important for people to just recognize that they're actually taking the time out to have that conversation. One of the members, by the way, who's now one of my colleagues in the House of Delegates, he would probably never even remember that this happened. I went to his office to talk about one of these bills, and he kicked his feet up on his table to show me the soles of his shoes and started texting and goes, you're lucky. I usually don't let non-constituents even come in here. I mean, it was just like, he was so rude and so disrespectful. And now we have to get along, and we get along great. We do.
Yeah.
Even though we're different parties and stuff. And so that can be frustrating. And then the last thing is, if you are really frustrated with someone at the end of the day, then two things. Number one, go grab a clipboard and go work for someone, volunteer for someone who is running to make sure that there's going to be better representation in that area. Number two, if that person who you're disagreeing with is your state rep, grab a clipboard and go put yourself on a ballot. And regardless of how hard it is to win, understand that simply by doing that, you're giving people a choice, and you're raising the issue and you're raising the dialogue of the issues that you want, that are important to you and to the community that you're from. That's what I did in 2017. Typically speaking, the profile of, from central casting of what counts as, an electable legislator isn't someone who's unemployed, uninsured at 32 years old, living at home with her mom, driving a 92 Dodge Shadow that was worth $324, as a transgender metalhead reporter, yogini, stepmom, vegetarian. Typically speaking, that is not the profile that gets elected, let alone one that goes up against a 26-year, 13-term incumbent who had been in office since I was 7 years old. And I won. I won a 4-way primary when I was being outspent, by 2 different candidates. I won, won by 11.5 points that primary. And I won big in the general election by almost 8 points as well, against, the aforementioned incumbent who had described himself as the, self-described chief homophobe of Virginia. Don't tell me it's too hard. I hope to demonstrate to you that it's like, look, the only thing that is outside of you, the only thing that's in your control in a campaign is how hard you personally are willing to work. And I think that's a lesson that also goes to advocates. Yes, you have to take self-care. You know what my self-care has been this summer? I went to go see Metallica. That's my self-care. Like, just go have a great night. Go have a good time, right? Because, you're knocking doors all day. You're fundraising. You're doing whatever. Go take some time out. Go have some fun. And at the same time, once you've recharged your batteries a bit, go right back out there. Because remember, for as hard as it can be for you, the other side doesn't give up. The other side's not, just, piecing out on this. If you're not there, who is? I don't say that because I want you to feel the burden of the world on your shoulders. I'm just saying that because if you burn out or if things go wrong for you and you can't keep going, then that means that we're losing someone who's doing the work to, create a better future.
Thank you. And I really appreciate what you said, because sometimes we only measure our success in these meetings by a vote, but sometimes even just planting a thought in their head that they might consider later can be productive. So I appreciate that. So I did want to give you a moment just to speak on your work on this issue, what it means to you and your community in Virginia, but also you personally. And then if we can try to end on a light note, what you're most looking forward to as we near the end of 2023. 2024 is going to be, in some states, a new legislative session. What makes you hopeful for the future when it comes to suicide prevention and LGBTQ?
Absolutely. So the first thing, last year I was the chief co-patron on a bill, or as a Democratic legislator, I was working with a Republican legislator who, Delegate Anthony Rotata, and we got this bill passed to create a suicide prevention coordinator in the Virginia Department for Veteran Services, for example, because we know 17 to 22 vets a day will die by suicide. And that includes my dad, who died in 1987, 2 days after Christmas when I was 3 years old. And it's one of my earliest childhood memories of running to my neighbor's house as my mom was at the top of the driveway screaming my dad's name as the fire engines were pulling up. Even though that doesn't deal with LGBTQ stuff, immediately, I want to mention that because any work and any advocacy that we do to keep people alive, to prevent suicide, is something that is good for the entire community, regardless of which particular group we might be advocating for on one particular day. I
Thank
also know that, oh yeah, and I also know that when in 2020 and 2021, when we passed about 24 pro-LGBTQ pieces of legislation, instead of LGBTQ families having to leave Virginia, they're like, hey, we belong here too. And the thing that is so hurtful with the governor's guidelines, about model policies for, trans youth and all, is all that work that we were doing for those 2 years to make sure that these families and these kids felt included here. He's immediately saying, not so fast. And that's not okay. I shouldn't have to be hearing from trans people and the parents of trans people saying, Danica, do I need to move to Maryland? Do I need to move to DC? Are we going to be okay with this? It shouldn't be like that. Everyone should be welcomed here because of who they are. Everyone should be safe here because of who they are. And what gives me hope is that we are still at a place where we have not even begun to reach our full potential as advocates in terms of getting a message out, saving lives, and really doing the work to make not just our Virginia a more inclusive Commonwealth, but our America a more inclusive country, so that no matter where you live in any state or any territory for that matter, that state to state, place to place where you go, you belong. And what gives me hope is that the right people are going to be vulnerable enough to be visible, to put their name on a ballot, to win elections that no one saw coming, and then go change the world with it.
Well, thank you so much for joining us today. I really appreciate it and appreciate ending on that hopeful note. I know it's been a hard year, but we really appreciate all the work you do.
Thank you so much. I appreciate the work that you all do so much as well. Thank you.
Thank you.
Thank you. And now to conclude, I have some action steps you can take and resources for you. So you can first take action via the AFSP Action Center. Sign up as a volunteer advocate to receive regular updates. Learn about and email your members of Congress and state legislators so you can introduce yourself and your connection to suicide. We will email you whenever state or federal bills come up that you can email them in support or opposition to. You can personalize these emails as a way to start building relationship with those legislators. And then not just learning about your officials, but also state leadership, committee members. Are there members of your state legislature who do a lot of work in LGBTQ and mental health related legislation, and building relationships with them? You can also utilize the Action Center to find social media handles for officials and thank those who are supporting our policy priorities. Another way to utilize the Action Center is logging the relationships and interactions you have with your elected officials. So for example, if you have a state legislator that's a neighbor or a friend, or an interaction would include a meeting with a legislator, testimony you provide, you can log all of that through the Action Center. You can also track bills AFSP is actively supporting or opposing in your state. Can filter by issue, state, stance, or link to the bill. And I do want to note that for the real world effects for professionals working in, for example, primary care, mental health care, as well as those working in news and media, it's really critical to be aware of the existing state laws and court decisions affecting LGBTQ youth adults, the provision of patient care, and the community as a whole, such as school systems. So this is a good resource for that. You can also utilize our general advocacy resources, watch previous webinars and training videos, read issue briefs and blogs on our top policy issues, which include data, existing laws, and also sign up for policy events such as our state capitol days that are held in the spring. Read and share AFSP's LGBTQ policy materials. So if you visit that link, you can download the issue brief, which has a very detailed overview of everything I discussed today, existing laws, what AFSP is currently doing, as well as some additional resources. Learn about AFSP-funded LGBTQ research studies, and then also access additional AFSP resources and events. And some of those are Talk Saves Lives, an introduction to suicide prevention LGBTQ, which provides insight on suicide, research on prevention, and what people can do in their communities to save lives. And particularly, it discusses the stressors that LGBTQ people face. Stronger Communities, LGBTQ Suicide Prevention is a full-day conference hosted by local chapters to raise awareness about suicide risk, bring research findings to the attention of professionals and the public, and explore strategies for LGBTQ suicide prevention in local communities. We also have a resource on talking about suicide in LGBTQ populations to help with language and how to speak to members of your community. Healing Conversations is a program that connects those who have lost a loved one to suicide with trained volunteers who are also suicide loss survivors. So you can connect with those with similar identity and loss experience, including for LGBTQ people and their loved ones. And then we also encourage the media to reference AFSP's safe reporting guidelines to minimize hopelessness and increase help seeking when covering this news and topics related to suicide. And you can also contact your local AFSP chapter at any time for any of these resources. And then finally, seek out local in-person interactions with policymakers, community leaders, and stakeholders. So visit your local district offices to educate and meet lawmakers and staff. Bring general information on AFSP and our work, not just on policy, as a way to open up communication. You can invite them to events such as Out of the Darkness walks. Sign up for newsletters to see what lawmakers care about and where they'll be. It's very important to remember politics are local. So attend town halls, school board meetings, city council meetings, and hearings. This is a way for you to address misinformation and educate people on the facts. Speak at these meetings, provide testimony, hand out educational materials. And for this, you can reach out to your chapter again, who can connect you with our team, and we can help you with any of these testimony or making sure you have the right materials for the right event. Share and promote protective LGBTQ policy examples. So this helps to identify lawmakers to champion legislation. So where does legislation come from and who decides what gets made into law? It comes from legislators based on their personal experience and interests, but it also comes from you when you share your story as advocates and constituents. And it comes from organizations like AFSP that work directly with legislators and other leading mental health organizations to write policy and provide resources to support future legislation. And you can help us make that connection. Some protective legislative examples, just real quickly: insurance coverage for gender-affirming care, public and private, protections in schools regarding disclosures and bullying, school curriculum, conversion therapy bans. So Maryland this year passed a law that requires the Maryland Medical Assistance Program to provide gender-affirming treatment in a non-discriminatory manner. Maine passed a bill this year increasing access by allowing gender-affirming hormone therapy and follow-up care to be provided to minors 16 years and older without consent of parent or guardian. Nevada now requires public and private health insurance policies, including Medicaid, to cover treatments of conditions relating to gender dysphoria and gender incongruence. And then there's also an Illinois law that requires that, the curriculum include and teach the history and contributions of lesbian, gay, bisexual, and transgender people. And then finally, just to wrap up, connect with your local LGBTQ advocacy groups and chapters who are already doing the work. We do not need to reinvent the wheel, but we can offer our support, help with public education efforts. We can table at their events and also invite them to table at our events. And you can also engage and provide support via social media. And with that, thank you so much for joining us today. We are here to help. So please, you can also contact us anytime at advocacy@afsp.org for more information on the resources or for any guidance on the action steps covered today. And then if you are on social media, don't forget to tag AFSP Advocacy and AFSP National. Thank you.